November 3rd, 1943. 06:17 hours. The Volturno Valley, Italy. The cold arrived before dawn. It moved through the valley like something alive, seeping into canvas tents and beneath wool blankets, turning breath to vapor and metal to ice. In the field hospital 3 miles behind the front lines, Medical Officer Captain Thomas Brennan pulled his coat tighter and watched the first ambulances crawl through the mud. The temperature had dropped to 0 degrees Celsius. The wounded kept coming. Brennan was 29 years old. He'd been a surgeon in Manchester before the war. Now he worked in a tent. Now he made decisions in seconds that should have taken hours. Now he carried a leather pouch containing 12 morphine syrettes, and by noon, that pouch would be empty. The first casualty arrived at 06:42. Private James Whitmore. Shrapnel wounds to the abdomen and left leg. His uniform was soaked through, half frozen. His lips had turned blue. Brennan administered half a grain of morphine tartrate, the standard dose. He pressed the syrette into Whitmore's upper arm, squeezed the tube, felt it empty. Then he pinned the used syrette to the soldier's collar. Protocol. It was supposed to prevent overdose. Brennan moved to the next stretcher. By 0800, 17 wounded men filled the receiving tent. By 0930, 43. Most had been lying in frozen foxholes for hours before medics could reach them. Most had already received morphine in the field. Brennan treated what he could treat: tourniquets, sulfa powder, pressure bandages. And when the pain was severe, when shock threatened to kill, he administered more morphine. What Brennan didn't know, what nobody knew yet, was that cold changes everything. It slows the heart. It constricts blood vessels. It traps morphine in tissue, preventing absorption, delaying the drug's effect. A wounded man injected in a frozen field might feel nothing for an hour or longer. The medic would see him still in pain and assume the first dose hadn't worked. He would administer another, then another. The morphine would accumulate in cold flesh like water behind a dam. And when that man was finally brought to a warm hospital, when his body temperature rose and circulation returned, all of that trapped morphine would flood his system at once. Private Whitmore was transferred to the surgical ward at 10:15. His wounds had been cleaned and dressed. He was placed near a kerosene heater to combat hypothermia. Within 20 minutes, his breathing began to slow. Within 30, his pupils had contracted to pinpoints. Within 40, he stopped breathing entirely. Brennan ran. Whitmore's pulse was barely detectable. His skin had gone from blue to gray. Brennan administered atropine. He forced oxygen through a breathing bag. He worked for 18 minutes before Whitmore's heart restarted. The private survived, barely, but he remained unconscious, trapped in a morphine-induced coma that medical textbooks said should have been impossible. If you're watching this because you want to discover more stories like this, stories of medical crises that changed battlefield doctrine forever, make sure you're subscribed. We're uncovering the forgotten moments when military medicine learned its hardest lessons, one catastrophic mistake at a time. By noon, 3 more soldiers had collapsed with identical symptoms: profound respiratory depression, pinpoint pupils, coma. All had received standard doses of morphine. All had been wounded in freezing conditions. All had nearly died in a warm hospital, not from their injuries, but from the drug meant to save them. Brennan called an emergency meeting at 13:30. 6 medical officers crowded into his tent. He laid out the pattern: the cold, the delayed absorption, the cascade of symptoms once circulation returned. One by one, the other doctors nodded. They'd seen it too. Men arriving stable and conscious, suddenly collapsing hours later as if poisoned. Except They had been poisoned. By medicine. By protocol. The question wasn't whether it was happening. The question was, how many? How many wounded soldiers had received multiple doses of morphine in the field, their frozen bodies unable to absorb it? How many were lying in hospital beds right now, the morphine accumulating in their blood like a time bomb? At 1500, Brennan issued new orders. All patients who had received morphine in cold conditions were to be monitored continuously. Oxygen at every bedside. Atropine prepared in advance. No more routine morphine administration. The protocol that had saved thousands had just proven itself capable of killing them. But orders take time to spread. By the time Brennan's message reached the forward aid stations, another 37 soldiers had been treated for severe wounds. Another 37 had been injected with morphine in freezing temperatures. Another 37 were on their way to warm tents where their bodies would betray them. The crisis peaked on November 5th. Across the Fifth Army's theater of operations, medical officers reported identical cases. Men collapsing hours after admission. Men with pinpoint pupils and failing respiration. Men in comas that shouldn't exist. At the 15th evacuation hospital, 12 soldiers stopped breathing within a 6-hour window. At the 56th, 9. At the 95th, 14. Some died. Not many, but enough. Private First Class Michael Donnelly, Corporal Alan Fisher, Sergeant James Howe. 3 men among many who survived German artillery only to suffocate in an American hospital bed, their lungs paralyzed by a drug that was supposed to ease their pain. If this kind of deep dive into the hidden medical crises of World War II fascinates you, you're in the right place. Hit that subscribe button because we're building an archive of the stories the textbooks left out, the moments when doctors became detectives and medicine became a battlefield of its own. On November 11th, the Fifth Army convened a formal medical meeting. Every chief medical officer attended. The evidence was presented in cold, clinical language. Delayed absorption, cumulative dosing, respiratory depression, coma, death. The mechanism was understood now. The danger was clear. The new guidelines were issued on November 15th. Morphine was no longer to be administered routinely. Only for severe pain and only after careful assessment. Doses were to be reduced in cold weather. No soldier was to receive more than 1 injection within 2 hours. Most importantly, any patient who had received morphine in freezing conditions was to be treated as a potential poisoning case, monitored continuously as their body temperature normalized. The changes saved lives. Within 2 weeks, cases of morphine poisoning dropped by 70%. Within a month, the crisis had been contained, but the damage had been done. Medical records show that at least 83 soldiers suffered severe morphine poisoning. At least 14 died. The actual numbers were likely higher. Many cases went unrecognized, misdiagnosed as head injuries or shock. Captain Brennan continued treating wounded soldiers until the war ended. He returned to Manchester in 1946, resumed his surgical practice, never spoke publicly about what happened in the Volturno Valley. But the lessons learned in that frozen field hospital spread through military medicine like ripples on water. New protocols were written. New training programs were developed. The morphine syringe was finally understood not as a miracle, but as a tool, dangerous in the wrong conditions, lethal when misused. Private James Whitmore regained consciousness on November 8th, 5 days after his collapse. His wounds healed, his lungs recovered. He never learned what had nearly killed him in that hospital tent. He never learned that the morphine meant to ease his pain had instead stopped his heart. He simply knew that he'd survived, and survival was enough. For those of you who appreciate these deep explorations into the medical innovations and catastrophes that shaped modern warfare, we're creating a collection unlike anything else out there. Subscribe, and you'll get access to stories about the forgotten doctors, the overlooked disasters, the moments when medicine had to learn its lessons in blood. The official report on morphine poisoning in cold weather combat was filed on January 12, 1944. It ran to 47 pages, dense with medical terminology and statistical analysis. It documented every case, every symptom, every intervention. It concluded with a single recommendation: that all military medical personnel be trained to recognize delayed morphine poisoning. The report was classified secret. It remained classified for 30 years. When it was declassified in 1974, the medical community barely noticed. The crisis had been forgotten. The soldiers who suffered had aged into their 50s. The doctors who treated them had retired or died. The lessons learned had been absorbed into standard practice so thoroughly that their origin had been erased. But history remembers. History keeps these records, these files, these moments when human error and environmental circumstance combined to create catastrophe. History preserves the names of the men who suffered, the doctors who fought to save them, the protocols that were rewritten in their wake. The morphine crisis of November 1943 wasn't the largest medical disaster of World War II. It wasn't the deadliest or the most dramatic. But it was emblematic of a larger truth: that war forces medicine to evolve faster than it should, to learn harder than it can bear, to make mistakes that cost lives before solutions can be found. Captain Brennan's legacy isn't in medals or commendations. It's in the protocols that now govern battlefield medicine. It's in the training that teaches medics to consider environment, temperature, circulation before administering any drug. It's in the thousands of soldiers who received morphine in cold conditions after 1943 and survived because someone, somewhere, had learned from the men who didn't. That's what this channel is about: the invisible architecture, the forgotten lessons, the moments when war forced humanity to understand itself better, even at terrible cost. If that resonates with you, make sure you're subscribed, because these stories, these hidden chapters of history, they're the ones that matter most. The frozen valley, the collapsing soldiers, the morphine that accumulated in cold flesh until it became poison. These aren't just historical curiosities. They're reminders that medicine is a practice, not a perfection. That every protocol was written in response to someone's suffering. That the treatments we trust today were experiments yesterday, tested on soldiers who had no choice but to serve as subjects in a trial they never volunteered for. 80 years later, morphine is still used on battlefields. But the protocols have changed. The training has evolved. Every military medic now learns about delayed absorption, about the dangers of repeated dosing in cold weather, about the signs of respiratory depression. They learn it in classrooms, from textbooks, from instructors who've never heard of Captain Brennan or the Volturno Valley. The knowledge has been separated from its origin. The lesson has outlived its teachers. Captain Thomas Brennan died in 1987. He was 73 years old. His obituary mentioned his distinguished career, his service in World War II, his dedication to patients. It didn't mention the crisis. It didn't mention the night he saved Whitmore's life, or the morning he realized that protocol was killing soldiers. That part of his story died with him. But the knowledge remains. In every military medical manual, in every combat medic's training, in every protocol that says, consider the temperature before administering morphine. The knowledge remains because Captain Brennan and the doctors who worked alongside him refused to accept that soldiers should die from medicine. They documented every case. They analyzed every failure. They changed the system. The Volturno Valley is quiet now. The field hospitals are gone. The frozen foxholes have been filled in by 80 years of weather. Nothing marks the place where Captain Brennan worked through those terrible days. Nothing except the records, the protocols, the invisible architecture of knowledge built on tragedy. This is their monument. This is their memorial. The knowledge that their suffering, accidental and unchosen, made every battlefield safer for every soldier who came after them. That's the legacy of November 1943. Not glory, not victory. Just the cold, hard-won knowledge that in war, even medicine can kill, and only vigilance can prevent the next crisis.